We're going to show you a test, how to test sympathetic dominance. And what sympathetic dominance is when your sympathetic nervous system and your parasympathetic nervous system is out of balance in a way that sympathetic is dominating your condition all the time. And so if you're sympathetic, you're not resting, digesting, you don't have the ability to relax, right? Your body is in continuous fight or flight. And it'll stay in fight or flight. And so Mark Bookout came out with this test. And what he was doing, and it's quite ingenious, is he's using the way the brain processes pain signals to figure out whether or not you're in a sympathetic state or not. Because when you're in a sympathetic state, your brain flips the pain signal. So little pain, that would be normally little pain, hurts a lot, and big pains don't hurt at all. So that's that sympathetic protective mechanism. And so if she's sympathetic dominant, and I just do this, that could actually cause pain to somebody who's sympathetic dominant. But if she gets a gash in her arm, then she may not even feel that, right? And that's the protective mechanism of sympathetic dominance. And so what I'm going to do is I'm going to give her a stretch on the sciatic nerve through the hamstring, right? I'm coming in and just a little bit medial with the leg. Like, okay, do you feel that stretch? Mm-hmm. And so then I'm going to put a dural stretch on the other side. It's basically the slump test laying down. So I'm going to come under, I'm going to lay my forearm on her shoulder to keep her shoulders from coming up. I'm going to come under here, and okay. Now does that stretch better, worse, or the same? And it gets actually way better. Okay, so what happened there was I'm stretching the hamstring, putting stretch on the sciatic nerve, and on the other side, through the dura, I'm stretching the other side, putting a dural strain on the sciatic nerve, right? That should get worse if you have sciatica. It should be the same if you're just fine. And if you're sympathetic dominant, it will feel better. She is on the end of sympathetic dominant, actually. So if I come under here, and she actually becomes more flexible. And so that is sympathetic fight, flight, or freeze response. This is the freeze response in sympathetic dominant. And so let's talk about that a little bit. So freeze is not a weakness. Okay, we'll be clear on that. So we've did neural reset on a Green Beret, and he was freezing. Okay, and it's a protective mechanism for you to handle intense situations as a survival mechanism. So Lee Cartwright was the guy who basically explained this the best. And Lee has got a video online. Lee passed away, but his wife posted all of his work, or most of his work. It's great. And he has a video on YouTube called The Biological Drama of Trauma. Biological Drama of Trauma. It's like a 3-hour video on how the body processes trauma, right? It's really good if you want to understand how all this stuff works. And so we've taken that and we adapted it into the manual therapy world. And Lee was a great therapist for trauma. Lee was a guy who had a wait list to get on his wait list. And so you call Lee in September, he'd be like, okay, and I'll call you later. And like April, he'd call you and say, okay, you're on the wait list. And then eventually you get an appointment with Lee, right? The guy, he was that good. And so what she's doing here is she's going into a freeze mechanism as a protective mechanism. And so what Lee described this as a mouse. So if a cat catches a mouse, the mouse goes dead, plays dead. If the mouse fights the cat, the mouse will die, right? Because he ain't gonna win that fight. And so his body goes limp. But inside, what's going on when somebody's using freeze as their defense mechanism is the heart rate's going up, the adrenals are ramping up and spitting out adrenaline. You're gonna have anxiety, vasodilation, digestion is gonna slow down, and the body's thinking about shutting down the muscles and ramping up the insides. And the reason why that happens is because as soon as the cat gets the mouse goes limp. The cat gets bored, drops the mouse. Then as soon as the mouse hits the ground, well, his insides are ramped up, ready to fire, and it'll just launch. And so the mouse splits, and that is his survival mechanism. And so this is not uncommon at all. And so a lot of people use this mechanism, but I would guess she is tending towards anxiety and digestive issues and things like that based on this test. And so we have 4 ways to get them out of this. And one is treating the dura itself. We're going to show in the epidural. The epidural scar will cause this. emotional shocks, toxic shocks, and structural issues. Like 4 of those will cause you to go in sympathetic dominance and stay there. And so we've been able to get everybody out of sympathetic dominance who we've tested. That is, we're well over 500. So the test, you put a stretch on the hamstring, and then you lay your arm on the shoulder, and you lift the leg, and is it better, worse, the same, the stretch? And hers is better. If it's worse, this person has sciatica. If it's the same, there's nothing wrong. If it's better, sympathetic dominance. They don't always stretch like that. That's freeze. You would test both sides, because this side, which I wouldn't normally reach across a patient like this, I would never do this, but in the video I will. So look at the difference between her flexibility on each side. So, okay, you have that stretch, and then is that stretch better, worse, the same? And it's letting go too. So she's bilateral. Not everybody's the same on both sides. So you want to treat that, and you want to go back and retest it and make sure you got that. All the treatments for this, except for the epidural, is in the other courses. So that's sympathetic dominance.